Hi, it's a very beautiful day in Ankara, Turkey now. Today we have a very special guest who is a pediatric endocrinologist and who has done all her residencies in United States of America. So, Dr. Pınar, can you tell about something about yourself? Who are you? What are you doing?
It's a pleasure to be here. I'm very happy to talk about, today we are going to talk about hypothyroidism, and it's a great pleasure. I'm a pediatric endocrinologist. Pediatric endocrinologists, what do? They treat kids with hormonal problems.
Hormonal problems?
Yes. Hormones are not only sex steroids, sex hormones, growth hormone, thyroid hormones, and there are many other hormones in the body. So we are dealing with problems with the hormones. In children.
In children. You have said that you deal with hormones. Mainly we will speak about hypothyroidism, especially in children today. But you have said something strange, hormone. What's a hormone?
A hormone is a substance that the glands produce, and the hormones bind to a special part of the body to make the body do some functions. It's like the key and the lock.
Are they important functions?
Very important functions. Depending on the type of hormones, many different functions are done by the help of the hormones. It's kind of like the key and the lock.
Yeah.
The key is the hormone, and the lock is what we call receptors. So they bind to those receptors. The key goes to the lock and opens the door to a function, and that function happens with the help of the hormones. So they are very important in the body.
You said something like growth hormone. Does it really grow the subject?
Excuse me?
Does it really grow the subject? You have said growth hormone.
Growth hormone is what we have. Both kids and adults need growth hormone. It's not only for growth. There are other functions in the body besides growth. But because I'm a pediatric endocrinologist, it's very important for us because kids grow. They grow from the time they're born until the growth plates, what we call, are closed, which could be until the age of 15 to until the age of 18 and sometimes 22, depending on the person. So growth hormone basically in my area is important for growth. But there are, of course, as you know, because you are an endocrinologist yourself, adult endocrinologist, there are some other important functions in the body.
Of course. And we are going to speak about thyroid hormones today. As far as I know, I cannot know as much as you because you are a pediatric endocrinologist, but as far as I know, thyroid hormones are more important than growth hormone in linear growth of the patients.
Yes.
Mine is yesterday's knowledge because I have read a long time ago. As far as I know, someone with growth hormone deficiency can reach up to 140 centimeters, but someone with thyroid hormone deficiency can reach up to 130. This was a figure. It may be wrong, but just to imply that thyroid hormone may be more important than growth hormone in the linear
growth. That's true. And even if somebody is growth hormone deficient, let's see, and you provide that kid with growth hormone, you give growth hormone treatment to that kid, to that child, if he or she is hypothyroid, especially with if the thyroid gland is not working at all, the child cannot grow, even if you give growth hormone. So it's really important to have enough thyroid hormone to be able to grow.
Then I understand two things from here. Both hormones are important, but there is also a relation between the hormones.
Yes,
both must be at the same time, at the same place.
Yes. Both hormones should be present for the child to grow properly. Otherwise, if one is absent, the child is not going to grow just having only the thyroid or the growth hormone alone. So both hormone levels should be good enough for the child to be able to grow.
We both know that hormones are very, very important molecules that are secreted in very tiny, very small amounts indeed in the body and have very important functions. Today we're going to speak about thyroid hormones. When we say about thyroid hormones, we generally imply a very different range of diseases. What kind of diseases most frequently seen in childhood period? Related to thyroid hormones.
Related to thyroid hormone, the most common problem we see is hypothyroidism, meaning underactive thyroid gland, meaning not enough thyroid hormone. So that's the most common problem we see in childhood period related to thyroid gland.
What percentage of the children do have hypothyroidism, low functioning thyroid gland?
About in almost all over the world, what we call congenital hypothyroidism, meaning you are born with underactive thyroid, is about 1 in 3 to 4,000 babies are born with it. So it's fairly common to see, and it's almost the same frequency all over the world, except for areas like China or Africa. There is a little bit higher incidence of iodine deficiency. Iodine is very important for thyroid hormone production.
Yes.
So if you don't have enough iodine, you can't have a normal thyroid. And if a pregnant woman is iodine deficient, then the child, the baby may be born with a condition what we call cretinism or iodine deficiency related hypothyroidism. So in those areas with high frequency of iodine deficiency, hypothyroidism due to iodine deficiency is much more common. So the incidence might be higher than 1 in 3,000 babies with hypothyroidism, but in general, all over the world, in Turkey, in United States, it's about 3 to 4,000. 1 in 3 to 4,000 babies are born with congenital hypothyroidism.
You said iodine is very important for thyroid hormones. I think it's because it's in the structure of the thyroid hormone. Iodine takes a very important part, and also in the activation of thyroid hormones. Then you said that there's iodine deficiency in several areas, particularly Africa and also China. It was also a problem in Turkey too, but we are, I think, somewhat moderately deficient now, not so really.
In the past, it was about 30%, and now, according to the latest publications, it's about 5%, and it's not very severe. The reason why we were able to decrease the incidence of iodine deficiency is the government policy, addition of iodine into the salt, into water and bread made the iodine deficiency almost go away. There are only a few areas, especially the northern part of Turkey is a little bit higher in iodine deficiency, but in general, we almost never see cretinism, for example, in newborn babies anymore in Turkey. But in China and in some parts of Africa, I know that there are some areas with iodine deficiency. It's actually very easy to get over.
Very easy and very cheap.
Very easy and very cheap. Iodine containing salt is the easiest way. You just cook with iodine containing salt, table salt, and it will decrease, especially for pregnant women. It's very important because it causes permanent brain damage, especially in newborn, even if they are born and treated right away in newborn period, they're already brain damaged because during intrauterine period, you need iodine and thyroid hormone for the baby's brain to grow properly. Compared to congenital hypothyroidism, where you can treat a newborn and you get a perfectly normal child if you treat properly, iodine deficiency is different. They might be born with what we call neurogenic cretinism, where the brain damage is irreversible, unfortunately.
I see. Okay, then what must the pregnant women in Africa do to
Well, that's a
see whether
difficult-
they are iodine deficient, whether do they need iodine?
Actually, that's a very difficult question because I'm not 100% sure about Africa and how they do medical care. But to check iodine is easy. You can check in the urine, and if there is deficiency, the pregnant woman can be supplemented with iodine to prevent problems with iodine deficiency.
Mainly in the adults, most of the patients, of course, pregnant women are adults, and they
you
have,
probably know more than
generally a very prominent thyroid gland.
Yes,
in this
goiter.
area. Yeah, iodine deficient goiter is characterized by a very large gland that's easily seen on the neck. I have also some kind of goiter, but not so easily seen, but bigger than my throat. There you will see a mass over
there's
there.
a lump, like
Yeah, a lump,
big
like-
lump in the neck area.
Yeah, it may be irregular or regular, generally soft in palpation. If you see this one, you may have iodine deficiency. Thus, please consult your obstetrician over there, whether you are iodine deficient and you need iodine. It is very easy and very, very cheap. And
To treat,
prevents very, very important problems that your child may have if not treated. Well, there is also congenital hypothyroidism we have spoken about, and said that it's easily recognized and is easily treated, but if not treated, it's also very dangerous.
Congenital hypothyroidism is a little bit different. In babies, when they are born, 95% of babies with congenital hypothyroidism may not have any symptoms. That's the tricky part. They might be totally normal-looking babies, but they may still have an underactive thyroid gland. That's why a lot of countries are doing newborn screening, which means we get a couple drop of blood from a heel stick of the baby and check a few conditions that we can treat easily and prevent major problems later on in life. Congenital hypothyroidism is one of them. A lot of countries are now screening, looking at babies to see if they are hypothyroid in newborn period. Usually we do take the blood about 2 to 3 days after birth, 48 to 72 hours after birth, because if you check too early, you may misdiagnose as...
Why?
Because when the baby is born, it's a very stressful condition for the baby. All the hormones go up, including thyroid hormone levels. But what we do to check hypothyroidism, underactive thyroid, is to check what we call TSH. It's a hormone that's produced from the brain, from the pituitary gland, which is a brain at the back of our nose. It's a tiny, tiny gland, and it produces a lot of hormones that regulate our body function. And TSH is one of the hormones that pituitary gland produces. And if the thyroid gland is not working, TSH will go up. That's how we diagnose underactive thyroid, because it's in a balance. If the thyroid gland is not working, TSH will go up to push the thyroid gland to produce more growth hormone. Thyroid hormone, I'm sorry. So if the baby is in stress, the TSH will go up, not because the thyroid gland is not working, it's just because of the stress of the birth. And because of that, if you check thyroid hormones too early, then you might think the TSH is high. Oh, the baby has hypothyroidism. So we have to wait about 48 to 72 hours to check and see if the TSH is within the normal range. Saying that for newborns, the normal levels of TSH is a little bit different. Because of the stress, the TSH will go up. Although the thyroid gland is working normally, TSH is a little bit higher than normal adult level. So we have to consider that when looking at the results of a newborn baby for hypothyroidism.
After checking all infants for congenital hypothyroidism, seeing the TSH levels, you recheck it again a few days later or a few weeks later.
That's true. That's not true for every country. For example, in United States, in where I was a doctor in United States in Michigan, there's only one check.
One check.
In Colorado, there are two checks. They check at 2 to 3 days of life and at 10 to 15 days of life. But in Michigan, we check once. We used to check.
What do we do in Turkey?
In Turkey, we check in 2 to 3 days of life and then at 5th day of life.
At 5th, not first or second week?
No, 5 days.
Just at the 5 days, then if we find congenital hypothyroidism, we begin to treat.
Well, that depends again. Depends on the level. For example, if the level is moderately high, it may still go down over time. So what we do, we usually recheck in a week. And if we see a drop from the first or second, then we recheck. So we have about 3 to 4 weeks to decide whether the baby is going to need treatment or not, without affecting the brain development, because the thyroid hormone is extremely important for the brain development for the first 2.5 to 3 years of life. So you have to, if you start treatment, you have to continue treating until 2.5 to 3 years of age. And most of the time, unless there is special occasions, we stop treatment at age 2.5 to 3 years and do a trial of what we call, we take the medicine away, wait for 4 weeks, and then recheck to see if the baby is still going to need the treatment for lifelong. Because studies show that in newborn babies, sometimes we have to treat. We can't wait too long. It's, for example, 3 to 4 weeks, and it's still, the TSH is still high. We decided to treat. And the TSH may not be too high. For example, just to give you an idea for people watching us, TSH could be, for example, up to 10 might be normal for the first couple weeks. The baby might have a level of 12 or 13 at age 3 weeks. It's not totally normal. It's not too abnormal. Sometimes we wait, but if it continues to be at that level, we just decide to treat. But we stop at 2.5 to 3 years of life, of age, and then see what happens. We usually wait for 4 weeks, do another test, and see if it's going up or if it's staying normal. And I usually test again in 3 months and then in 6 months, depending on the levels. And then we say if everything is normal, that it was a transient problem and it went away. 50% of mild congenital hypothyroidism diagnosis will be transient.
Very good.
But if the level is too high, like if it's 100 or 1,000, I had patients with 1,500 TSH. Unless there's a special reason, this is not going to go away.
Of course.
And most of the time we have to increase the dose of the medicine during the first 3 years, and that also shows us that the baby is going to need it for lifelong. But say if you start the treatment for a mildly elevated TSH,
For example,
11, 15,
Yeah.
and you never had to increase the dose. You started the same dose, you went on checking the levels, and it's always normal. And at 2.5 years of age, you stop the medicine and check again, everything is fine, and we are fine.
Very good. Okay. If everything is fine, we are all fine. But if the things are not fine, you said TSH may be high and we may need treatment, sometimes continuously for lifelong.
Yes.
But we all know that thyroid hormone is a very tiny, very cheap, very easily accessible, and very ingestible medicine.
Yes.
And
It's not a
highly
it's not a shot. For example, some of the hormones you can't take by mouth.
Yeah.
You have to give a shot, like insulin is a hormone. Growth hormone is a shot. This is very easy.
Very easy.
And
I
cheap.
say this is very easy. Sometimes in our adult patients, when they see that it's a very small, very cheap, very easy to ingest, they say that this is something very easy. It's worthless.
It's like a vitamin, right?
Yeah,
They think it's a
sometimes
vitamin. We
they
may
think
not
this is
need
not
to
important.
take that.
Is thyroid hormone really important?
It is.
What happens if you do not treat a child with congenital hypothyroidism?
A lot of things happen. Compared to adults, the difference is a child is a growing person. Not only linear growth, meaning height growth, brain development is extremely important, especially for the first 3 years of life. It's extremely important to have normal thyroid functions, to have neurodevelopmentally normal, developmentally to be normal. It's very important. Linear growth is the second one. A lot of body functions depend on thyroid gland.
You mean that it will be growth retarded and mentally
Retarded. The child
this is
may
very, very important.
The child cannot talk, cannot walk, could just lay on bed and then do nothing. Cannot follow you, cannot smile. Maybe it may smile, but it could cause severe mental retardation. But it's so easy to treat, as you said. It's easy to diagnose, easy to treat. So it's very sad when we see babies who are not diagnosed or treated and become dependent to their parents and cannot walk or talk just because of a very easy medication, easy treatment.
We will give a short commercial break. Welcome back to our program. Did you see congenital hypothyroid patients who are not treated, for example, at the age of 1 or 2 or 3?
Well, I was lucky not to see any of them. No, not in Turkey, because
Really?
well, I have been I was in the United States for a long time, so I was, by the time I came back 5 years ago, and even before I went, congenital hypothyroidism was screened in Turkey.
Today,
I haven't seen any.
Still screened. This means screening is very, very important for us. If our audience, maybe some countries do not have screening options, what must a mother or father look after at her child?
Yes, there are few
symptoms of hypothyroidism.
Well, as I said, by the time the symptoms appear, unfortunately, the brain development might already be affected. The only way to avoid mental retardation due to hypothyroidism is, unfortunately, to do a test in the newborn period.
At most the first month.
The first month, yes.
Oh.
But if you don't treat, what we see is basically the baby will not be smiling, may not follow light or your face, cannot hold his or her neck, so will be very floppy, will have a hoarse cry. Usually the voice will be like a horse, like you have a common cold and you have a sore throat and your voice changes. It's kind of like that. The baby might have a very dry skin, might be cold, might have constipation, may sleep a lot, and maybe
Everything
chubby.
has slowed down.
Yes. And one of the other things that you may see in newborn period, that might be a warning sign, might be a prolonged jaundice. That might be a warning sign, especially the first 2 weeks or 3 weeks. If you still see a baby quite jaundiced, at least get TSH at that point. So those are the main, the skin will be dry and peeling, the umbilicus will be prolapsed, and constipation, and you know, they sleep all the time. They're not like crying, vigorous babies. They're like sleeping very quiet.
If the baby is not active, has jaundice or constipation, or tongue that's outside of the mouth.
Yes, big tongue.
Dry skin.
Again, these are this is going to take a while. There are only few percentage of babies that are born with these symptoms. Most of the time, the babies are born totally fine. And as time goes by, as hypothyroidism settles, by the age of 3 months, we see all these symptoms. But at that point, the brain might be damaged. So I would say, you know, if the baby is sleeping a lot, not waking up to be fed, and if there is jaundice that's not going away, those might be the 2 early warning signs, rather than waiting for the other symptoms to settle.
Can we easily recommend every parent to have a blood sample from their children and make a TSH measurement? That's thyroid stimulating hormone.
Yes,
I think it will be available almost everywhere, and
it's very easy. It's cheap, actually, not a very difficult test to do. If you know, if somebody requests that from their doctor, they should be able to do it. And I would recommend to do it a little bit later, not the first 2-3 days, maybe 5 days. If the reason why we do the first 2-3 days of life is before they are discharged from the hospital, so that they're not lost to follow up. As we have the baby in our hands, we just do it and let them go. But otherwise, I think the best time to do the test is the first week will be more reliable, because there are a lot of false positive results the first 3 days of life, especially if the baby is stressed. So we end up doing retesting a lot of babies because it's done a little bit earlier. But if there's a C-section, like a surgery to take the baby out, most of the time the parents stay in the hospital a little bit longer. I would do it a little bit later, so that we have a good sample as far as the time goes.
Very good. We have seen a patient which has high levels of TSH, for example, at the first week of his or her life. Then checked again within 3 or 4 weeks. And
no, we check every week.
Okay, we checked every week. And
unless it's 500 or 1,000, then we treat.
Of course. If it's, let's think the worst thing. Let's say the TSH level is 500. This is a very, very high number. In adults, the uppermost level I have seen was 107. This means 500 is extremely high for us.
I have seen a lot.
Yeah, 500 is very, very high, a very, very high level, and this means that most probably this will child lifelong treatment with levothyroxine. We said that levothyroxine is very easy to get, very cheap to get, and very, very effective. It prevents mental retardation, growth retardation, and these two are very, very important things. Yes. Does it really prevent these retardations in every patient?
Almost, I would say 100%, close to 100%. Yes. There are very rare occasions that we might see. It could be part of a syndrome, for example. Syndrome meaning the baby might have other health issues, then sometimes we don't. But I would say 100% with good treatment we can prevent. Even with the worst TSH, there are some reports that with very high TSH, there might be some learning issues in the future, or there are some reports saying that the hearing might be affected, but they're not a lot. And one thing I want to stress the importance is thyroid hormone is very cheap, easy to treat, but sometimes the medicine itself is not a good brand, or it's a generic that doesn't work well. It happened in United States. Even in United States, there was, when I was a doctor in United States in 2002, I think, there was one brand name of thyroid medicine that was taken out of market because it was shown that the pills does not have active thyroid hormone as good as it should. So it was out of market for a while. They retested and did all kinds of things, and it came back to the market. So what I have seen, and I want to warn the audiences that some of the thyroid medications that are in the market in some countries are not effective. I don't know why, but I would stress the importance of the medicine being a good brand name, or a medicine that's proven to be effective. Because I had several, not from Africa, but from other countries, came to see me in Turkey, and they are using the medicine, they're not missing any, and the dose is quite high, and it's not working. And I changed the medicine. I don't mean every medicine should go from Turkey to other countries, but I don't know, some medicines in other countries may not be as effective. So
I think we cannot predict that. How do we see that it's effective or not effective?
Well, if your child is taking it and it seems like the levels don't change, you have to question if the medicine is working or not, if it's a good medicine, because there are different pharmaceutical companies in different parts of the world producing this medicine, and it's one of the medications that they may not make it quite right. Although it's very cheap. Sometimes we see that. That's my own experience. Even in United States that happened.
This is a very important information, in that if rules are very strict in the United States and regulations are very strict, even in that country, if you have seen something like that, we may see it everywhere. In some of the adult patients, we also see sometimes problems like that. I don't want to accuse a specific company for it, but we have seen it both ways. And this is my experience. I have seen that the drug is not very easily handled. There are some minor rules in keeping the medicine. There are basically two brands in Turkey, and all contains 50 pills in the boxes. This means if you will use one pill per day, it will last for 50 days.
Yes, 2 months, almost 2 months.
Take it out, put it in, take it out, put it in, take it. And this is a medicine, preferably must not be exposed to light. It destroys efficiency. It must be kept in room temperature, not in the freezers or refrigerators. And it must be taken on
an empty stomach.
On an empty stomach.
Yes, in children too, we always stress. Babies, for example, they take formula or breastfeeding, and their stomach is small and it just empties fast. So you don't have to be fasting for an hour, but I usually say 15-20 minutes before feeding or an hour after feeding.
Very good.
If you if you give the medicine with the formula or with feeding, there are two problems. First, absorption is not good.
Yeah.
Second, the baby may throw up the formula or the breast milk,
Yes.
and goes the
Medicine will go
medicine. So you may lose some of the medicine and you don't know how much you lost.
Yes.
So empty stomach is important. I don't know if AFRİKA has soy formula. It's a special type of formula that's made from soy. If you are feeding the baby with soy, it decreases absorption tremendously, even if you give it by on empty stomach. So it's really important to adjust the medicine if the baby is fed by soy formula. I don't know if AFRİKA has that, but it's not very widely used in Turkey. It's very widely used in the United States, so that's something that's important. And one other thing to warn is it's a pill.
Yeah.
And we are giving this pill to a newborn. How are we going to do that?
Yes,
You
how are we
cannot-
going to do that?
You are not. You cannot prepare a solution. Meaning, some of the pharmacists are very kind and try to be helpful, and they say, "Oh, I'll prepare you a solution, a thyroid solution." That's not good because it's not stable
Yeah.
in water for a long time. So you have to prepare it fresh. So what I recommend to the mothers or parents for newborn babies is use a small amount of water and just put the pill. It dissolves. You can give this medicine with a spoon, which might be a little difficult in newborns. There are some little medicine bottles. You can, like a normal bottle, but it's only very small. The baby sucks the liquid
Liquids.
with the medicine.
Very good.
Or you can use an injector, a syringe.
Yeah.
So you take the medicine with the water, so it becomes a solution, but you have to prepare it fresh. You take it with a syringe and then give the baby the medicine with a syringe, drop by drop.
By taking out the
Of course,
needle.
take out the needle.
Okay.
Even drawing the solution, you don't need a needle. You can
Very
just draw it
To the syringe itself without the needle.
without the needle.
Of course.
Don't use the needle.
Oh, very good. This was a very important part indeed, because what we gain will be extremely important, extremely well, when you consider the price.
Yes, and
It
it's
gives you lots of
irreversible. You can't fix it. Once you have a brain damage, unfortunately, you can't fix it, and it's so easy to treat. So it's really important for the newborns to be tested for congenital hypothyroidism before it's too late, before all the symptoms settle, and the baby become mentally retarded irreversibly.
Reversible. Very important. I think this treatment is the most cost-effective treatment in
Yes.
all over the world, in all of between
Yes,
all the diseases.
exactly.
There is nothing like this.
Nothing like
It has-
congenital hypothyroidism that's so easy to diagnose, so easy to treat, and so awful if you don't
Yeah.
treat.
The medicine has almost no side effects.
No side effects,
Yeah.
that's true.
But-
Even if you give too much,
Yeah.
interestingly, like overactive thyroid, the opposite part of spectrum of the condition, overactive thyroid or hyperthyroidism may cause a lot of issues. But if you give the medicine a little bit too much, even for a couple months, nothing happens.
Okay.
It's interesting.
Very good. Then I see that these patients must all be in regular follow-ups.
Yes.
This is also very important.
Yes, exactly.
Because the dose adjustments may be necessary, sometimes frequently. Sometimes we do not need it at all. But
Yeah,
this-
I have babies. I start a medicine, a dose of the thyroid medicine, and it's the same until they're 18. And the parents are like, "You didn't do anything. You
Yeah.
started the medicine at age 1 week, and we are taking the same medicine. You didn't do anything. We got all
Yeah.
these blood tests, and it's still the same." And sometimes we have to increase. It's so child dependent. This is one of the medications that, you know, there are some guidelines how we start the medicine, but how much dose we are going to go as time goes by may change from one person or one child to the other. It's very person or child dependent. But there are some guidelines, especially for newborns. When they're born, we have a dose that we start with, and then we recheck and then make the adjustments. The thyroid medicine has a long half-life, meaning it takes a while to build up in the body. It takes a while to go away from the body. So we usually wait a few weeks. For newborns, when we first start, we just recheck in 2 weeks, and then every 4 to 6 weeks, and then we extend the period. But in general, you have to wait at least 4 weeks, as you know, 4 to 8 weeks, to see the result of the change in the dose that you are making.
You have cleared out lots of very important things over here. In adults, we also see lots of problems with thyroid hormone deficiencies. Even if in TSH levels like 6 or 7, we may have fertility issues. I've seen lots of patients like this. You give some levothyroxine to patients and the patient gets pregnant. This is excellent. There is nothing like this. Nothing so cheap, nothing so easy. Again, you have mentioned constipation. We see lots of patients with constipation, and that leads with levothyroxine treatment. Also focusing problems with the school, problems with the work. They also get easily resolved with levothyroxine treatment. Yes, we have to follow up patients, and patients sometimes also say us, what are you doing? We are giving the same medicine always and at the same dose. But this is very important. It is very important to have no complaints, no problems. This is very good. If you have problems, we may have missed something, or you may missed your medicines, and there may be bigger, higher, very important problems. And growth retardation and mental retardation are extremely important, and sometimes not resolvable problems. Because of this, recognizing an infant early
It's very important.
It's very important to begin the treatment and have very efficient results. Dr. Murat, thank you very much for today.
It was my pleasure. It was great to talk to you and
thank you.
to help the audience.
Thank you. I think you have been very helpful to our audience over here. Do you have anything to add? Your last words. What can you say?
I talked a lot. I don't know if I might have missed some points, but those are the main things I wanted to stress, that early diagnosis and treatment and the right medicine, right dose and follow-up, they're all important.
As take-home messages, we must say, please get your infant measured for TSH level in the first month of his or her life.
If possible, that's really important. Instead of waiting for the symptoms to appear, because it might be too late for the brain development. So early recognition, early treatment, and proper follow-up. Is very important.
Measure,
for children.
Treat, follow-up.
Yes.
These are very, very essential.
Exactly.
Okay. Thank you very much.
It was great to talk.
It was great to talk to you too. Have a nice day.